Good afternoon and welcome to today's hearing on the Health, Human Services, and Committee. I'm Councilman Priscilla Tyson and I chair the Health and Human Services Committee. I want to recognize Councilmember Emmanuel Remy, who has joined me for this hearing this afternoon. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the government television channel 3. The rebroadcast schedule is available at www.columbus.gov. The subject of this hearing is to review the 2019 budgets for Columbus Public Health and the Development Department's Human Services related funding as proposed in the 2019 operating budget. Speaking this afternoon, we have Health Commissioner Dr. Mashika Roberts, who will speak about the funding for Columbus Public Health. The Deputy Director of Community Development for the Community Development for the Department of Development, Hannah Jones, who will present on the Human Services funding. Traditionally, during this hearing, I've also had Workforce Development Committee present and asked that Civil Service Commission present on one of the city's most successful workforce development initiatives, and that's Restoration Academy. For the purpose of today's hearing, I will provide a brief update on the program based on information we received from Civil Service. And I don't know, Director DeLong, do you still want to share your information or do you want me to still read it?
Go ahead, I'll share just a couple words afterwards.
Okay, perfect. All right, so for today's purposes, again, I will provide a brief update on the program based on information from Columbus Civil Service. A total of $285,971 is budgeted for the Restoration Academy. This is a program that assists ex-offenders in becoming productive citizens through a rigorous, either 4 to 6 month work experience program provided by the city in partnership with several community organizations and employers. A multi-pronged approach is essential to the success of Restoration Academy and its participants. Human service organizations provide wraparound services such as health screenings, work readiness workshops, and other critical life skills workshops. Private and public sector employers provide job training and subsequently hire many other participants as permanent employees. Restoration Academy has experienced phenomenal results. Since the inception of the program in 2012, there have been 186 graduates. In addition to the impressive 87% graduation rate, 84% of the graduates are employed. The City of Columbus alone has hired 48 graduates, and the average hourly wage is $13.91. Most importantly, there has been a zero rate of graduate recidivism. It is also important to note that Restoration Academy will be holding a ceremony for its most recent class of graduates this coming Friday. There will be a total of 21 graduating this week, 11 men and 10 women, and 15 out of the 21 have already secured permanent employment. I'm always proud to speak about this program and the success of the participants. For those who are interested in Restoration Academy, please contact Tarika Cradle at 614-645-8038. And so I'm going to let Director DeLong, since you're here, I'll just transition to you right now.
Yeah. Thank you so much, and sorry about my tardiness. I'm trying to implement a new payroll system and was at some of the implementation with that. Basically, I want to say that I'm very passionate about this program, and for those individuals who are skeptical about hiring people with blemishes on their record, that my office currently has 3 full-time employees who works for civil service. All of them are great employees. They were not necessarily those employees who came in and interned with me as a part of the program, like many do. They intern and go completely into jobs after that. These were individuals who may have interned somewhere else, and because of something that happened, or because they really wanted a different kind of job than the internship was giving them. Internship was giving them stability, the ability to have an income and those kinds of things, but really not in their, I guess, wheelhouse of what they wanted to do. They took civil service tests as a part of being in the Restoration Academy, and we were able to reach them when we had hiring needs. So it's not that necessarily that these people come in and get jobs with the city, because that's not what this program is really about. And I think a lot of times people say, I want to be in Restoration Academy because I want a city job. Sometimes that's a benefit because they take tests and earn those positions through our competitive nature of how we hire here at the city, but it's not a give me. I also want to say that we also have a great employers who are starting to step up, and we're hoping that we can continue that with some of our larger employees here in Columbus. We are working with the Workforce Development Board and ResCare very closely this year, and we're also bringing in Alvis to look at revamping our program. And instead of maybe having a summer program, we may start earlier in the spring. So I want people who are interested in a program to make sure that they are looking and listening as we talk about it, because we're probably starting maybe in March or possibly earlier this year. So we're looking for probably 12 males and 12 females is what we're hoping to do this year. Thank you.
And Dr. Director DeLong, I just want to mention that, but Alvis isn't getting the funding from this that we're talking about in this budget. Is that correct?
It will go to the Workforce Development Board, who will push it out
To other organizations?
to other organizations.
Okay.
As well as, for some of it, could be possibly for the payroll of those individuals in the program as well.
Okay, thank you.
You're welcome.
And so now I want to transition to our other speakers, and the city's health and social service funding provides an opportunity to serve our most vulnerable residents. Our first speaker is our health commissioner, Dr. Mashika Roberts. We rely on the health department to address a multitude of public health needs, which requires them to track and investigate health problems and hazards in our community, prepare for and respond to public health emergencies, develop, apply, and enforce policies and regulations that improve health and ensure safety, and lead efforts to mobilize communities around important health issues. You will hear from Dr. Roberts about the health department's efforts to provide enhanced support to the city's harm reduction efforts, which is important because Columbus, much like other cities across the United States, is in the midst of an opioid crisis. Since 2003, Franklin County has witnessed a 423% increase in accidental overdose deaths. Because of the program's unbiased, non-stigmatizing, and human-centered approach, SafePoint is often the first point of contact for individuals living with a substance use disorder to receiving life-saving support services and to be linked to treatment. In addition, Columbus Public Health's budget will continue funding the Columbus Care Coalition, a collaborative program led by the Columbus Public Health to address community trauma. During the pilot phase of the program, they reached over 3,000 doors in direct neighborhood outreach. With that, I will now turn it over to Dr. Roberts to provide additional details on the Health Department's 2019 budget proposal.
Thank you. Thank you so much, Chair Tyson, and good afternoon to you and to Councilmember Remy. Thank you for the opportunity to highlight Columbus Public Health's proposed 2019 Health Special Revenue Fund budget of $33,575,419. As you mentioned, Columbus Public Health played a critical role in protecting the health and improving the lives of all residents in 2018. Yet our community continues to be challenged by an opiate epidemic, a lower but still high number of gun violence deaths, high infant mortality rates, and health disparities created by the social determinants of health. These critical issues will continue to impact the community as well as our work as we move into 2019. As you mentioned, Chair Tyson, the Columbus Care Coalition, which is a collaborative effort led by Columbus Public Health to address community trauma on one part, and it is a very important part of Mayor Ginther's comprehensive neighborhood safety strategy, continues to be funded in 2019. In 2017 and 2018, in our pilot years, we were successful in knocking on over 3,000 doors in neighborhoods and serving over 480 individuals following a traumatic incident. And we led trauma response care training for over 500 people. Additionally, the CARE Coalition offered special programs within the faith community, schools, as well as social media. In 2019, the CARE Coalition will continue to work with over 200 community partners to provide rapid crisis response, outreach and education, as well as trauma-responsive trainings to build resilient, healthy, and safe communities. New funding in 2019 of $414,423 is included in our budget to continue and expand the community-wide comprehensive harm reduction program to address the heroin and opiate use in our community. It also includes the addition of a senior leadership position for Columbus Public Health, which will provide oversight and coordination of the Franklin County Opiate Action Plan and our own addiction services program at Columbus Public Health. $300,000 will be added to the existing contract at SafePoint of $50,000 for a total of $350,000 to support the SafePoint program, which provides naloxone access, addiction counseling, treatment referrals, infectious disease screenings, linkage to care, as well as prevention education. And while working together with all of you to address these pressing public health issues, we also continue to provide the basic public health services that our residents depend on to live healthier and safer lives. In 2018, just a few examples of some of those basic services include giving nearly 28,000 immunizations to prevent and protect against preventable diseases, providing STD services to over 8,500 residents, investigating and responding to nearly 100 outbreaks in order to protect the public health, conducting more than 16,000 food inspections, and providing nearly 105,000 birth and death certificates. The proposed 2019 budget allows continued provision of public health service that are mandated, as well as priority programs that the Board of Health deems minimally essential to meet Ohio's public health standards. We also will address our community's priority areas while continuing our basic service and programs that protect health and improve lives. In closing, I just want to assure you all that your investment in our programming and our services means quality public health protection is available to our residents. We will continue to operate with high efficiency as well as effectiveness to protect the health and improve the lives of every resident in Columbus. As always, we appreciate your support and guidance of Columbus City Council through the process and all year long. I would be happy to answer any questions that either of you might have this evening. Thank you.
Thank you, Dr. Roberts, and certainly appreciate your leadership in Columbus Public Health and over the areas that you just mentioned. And I also thank you for taking on these additional responsibilities, fighting the opioid and heroin epidemic in our community, as well as I truly appreciate the work too around the issue of gun violence and also the health disparities and your ongoing work on maternal health and infant mortality. Just have a couple questions. There in your budget, and maybe it's a shifting of people, but I think there were 7 FTEs in your family health department that were there a loss of employees in your area, or was there a shift just of your people to a different area?
So are you saying there were 7 additional FTEs?
No, the loss of them in family health.
Yeah, those positions shifted to other areas within the department.
Okay, yeah. So no loss, and you're going to be adding some
loss.
Staffing based upon the new initiatives that you're taking on? Or
That is correct.
Okay, perfect. And also in your budget, you speak to enhancing the safety of children in and near and around schools. Can you elaborate on the specific programs that you are working with either the school system or just the work that you're doing to enhance the safety of children around our schools?
So one of our greatest accomplishments in that area is our Safe Routes to School program, which we do in collaboration with Columbus Police as well as the local YMCA and Columbus City Schools, and helping kids get to and from school safely, whether they're walking to school, whether they're riding their bikes to school, or whether they're being dropped off by their parents. So just making sure they have successful and safe pathways to school and home so that they make it to school so they can learn, and then they make it back home safely so they can be with their families. So that's some of the work we're going to be increasing in 2019 by increasing some of the schools we participate with.
Thank you. I don't have any other questions. Councilmember Meade? No questions? Thank you, Dr. Roberts.
Thank you.
And now I will transition to Hannah Jones, who will speak to the city's efforts to fund social service programs that have proven outcomes and are offering services to address the critical needs of our residents. In 2019, will represent the beginning of a new grant cycle to which organizations are currently applying. I understand that there was an information session held just yesterday so organizations could learn more about the request for proposal process. Proposals are being sought to create and maintain pathways and capacity building opportunities for people to move from economic insecurity to economic security as demonstrated by measurable results in one or more of the city's investment priorities, including income through employment, job quality, education and training, financial capability, and stabilization and resource supports. To provide additional details on the social service funding, I will turn it over to Hannah Jones. Good afternoon.
Good afternoon. Thank you very much, Chair Tyson, Councilmember Remy. Thank you for this opportunity to share our process with you. The overall human services budget for 2019 remains at $5 million. $2,630,000 comes from the general fund, and $2,370,000 comes from the Emergency Human Services Fund to reach the total of $5 million. As you mentioned, the majority of that funding is allocated to a competitive grant process that we provide for our human service partners in Columbus. In 2018, we began the process of closing out our first round of competitive grants for this funding, which took place originally in 2015. Through that process, we were able to support 31 organizations as they provided services to our residents in the following categories: Safety Net, which was emergency and basic needs; Economic Success, which focused on employment and self-sufficiency; and Social Success, which focused on providing healthy and safe neighborhoods, individuals, and relationships. Accomplishments from this round of funding included providing home-based counseling for over 600 women through Catholic Social Services. 16,000 to 18,000 households annually were served by the United Way's Tax Time program. As an essential Celebrate One partner, the Center for Healthy Families was able to maintain strong collaborative relationships with agencies in order to ensure that we were serving pregnant and parenting teens so they could achieve both the goal of high school graduation as well as the healthy delivery of their babies. We were also able to serve over 300 women through free legal services with the Legal Aid Society of Columbus in order to help them develop a plan to leave relationships or households that may have been abusive. As we've closed out this round, we have convened several conversations with internal and external partners, as well as a survey to all participating organizations to gain feedback on the process as we work towards a new competitive round, as you mentioned, of awards in 2019. We recognize that it takes time to get real results, which is why we're recommending another multi-year round. We will continue to work with the grantees to focus on the creation of good, measurable outcomes, as you stated earlier, that best articulate the accomplishments of these programs. We know that being able to report these is key to being able to show that we are making a difference in our community, but often they are difficult to design and measure, and we're committed to working with the organizations to really create outcomes that we can measure. We have also learned that great outcomes can be achieved by both large and small organizations, and that we can do more collectively than separately. With this spirit of collaboration and collective impact in mind, the administration, in partnership with your office, as you mentioned, announced on November 16th the release of the new RFP for approximately $4 million in overall funding. As you discussed, our focus is really on economic security and resilience for all of our Columbus residents, and we have 5 targeted areas that you outlined earlier that we will focus those applications on. The request proposals are being submitted until 5 p.m. on January 4th, as you mentioned, and all agencies that are selected upon review of the RFP will be eligible for both funding in 2019 and 2020. Year 2 funding will be contingent upon, of course, the availability of funding per budget year, as well as a review of your performance measures in Year 1 to ensure that we're on track with getting to the outcomes that we want as a city. One way that we hope to reduce the burden on our nonprofit organizations was that we've partnered with United Way of Central Ohio to streamline the submission process for our organizations. We're working with United Way's intake portal, which is called EC Impact, and that should hopefully help us allow to do an online submission process that's much easier and less cumbersome for our partners. As you mentioned, we held a very well-attended orientation session yesterday to go through the RFP, the guidelines, as well as to introduce organizations who might be unfamiliar with the new software to the system. The session was filmed, and we hope to be posting the video on the website as soon as it is available. We will also be maintaining an updated FAQ sheet based on questions that were received at the session, as well as from an intake email address that we've set up for people to provide us feedback to. That email address is humanserviceprograms@columbus.gov, and it will be open the entire time that we are taking applications, and then as questions come in, we will upload responses to them to be available to everybody. For those interested in applying or looking for any additional information, it can be found on the development webpage, which is www.columbus.gov/development. And we appreciate the continued support of you and your staff, as well as your colleagues, throughout this process, and we're happy to answer any questions you or the council member may have. Thank you.
Thank you. Just a couple questions about just the process. Can you share with the viewing and listening audience the process in terms of one, and just going through this process previously. One, if is a system set up, for an example, if someone doesn't send in the list of their board members, is there a process that immediately lets individuals know, that nonprofit applying, that they've missed a document, so it won't let them go any further, so that we're not so that the merits of the application can be read and be looked at by, well, we'll get to that next question, who's going to make the determination about the funding. But again, I'm just trying to make sure this new process, will it kick some application out and state that this is not completely, you're missing some important documents? Could you please elaborate on that?
So you, of course, went to an immediately technical question that is very important for all of our applicants. So I'm going to make Kim Stans, who's sitting in the back, come up, because he has actually been handling the portal directly. And I know where you're going with this, which is, yes, ultimately we do have a desire to have a curing period, but he can answer for you whether or not the application has some way of automatically notifying you, or if it is something that will answer on the other side of the process.
Thank you. I want to recognize President Pro Tem Michael Stenziano has just joined us. And Kim, good afternoon. Thanks for being here. And could you just really kind of share this whole process with the viewing and listening audience?
So just to answer the question that you had, with the United Way application, with their portal that they have, you will not be allowed to submit your application till all those things are in place. So no one will be kicked out. They won't be kicked out afterward, because they'll have already submitted everything they needed to. So I think what you may be referring to is, in the past, when we did this back in 2014, people didn't meet certain thresholds, so they didn't get reviewed. That won't happen this time, because they'll be told ahead of time that here's what they need to still submit. I'm not sure if that answers your question.
That answers the question.
Okay.
The next question I have is who's going to be deciding the recipients of these dollars?
So we are still in the process of identifying the internal and external committee members. I think that one of our challenges, as has been in previous years, is a lot of the experts are also the applicants. So as in the previous round, we will probably begin the process with your office as well as the administration to put together a working committee to evaluate them.
Thank you. And so we said it's pretty much going to be around $4 million, because we definitely, have dollars that are used for emergencies and human services, and we want to be able to meet that need also. So as you mentioned, there's a $5 million budget. However, again, we know that emergencies come up, and we want to be able to be responsive to those nonprofit organizations. And I just want to say thank you. I see that Michael Corey's in the audience, who is the president of the Human Service Chamber, and just really appreciate his work as well as the work of the nonprofit agencies that he works closely with. And many of the nonprofits are part of the Human Service Chamber. There are a few that may not be, but I can say that the individuals, the organizations that were in the last round, I want to say thank you to them. I know that each year before we funded them, even though they had to come and share the success of their work. I know they worked closely with you, Kim, and there was a process for them to make sure that they were meeting their goals. They met their goals, and they've done some incredible work in our community, and I want to acknowledge that. I also want to acknowledge that in the past, and that was before we had the epidemic of the opioid and heroin epidemic in this community. We got $13 million worth of applications then for $5 million, which still shows that there is a significant need for additional dollars to support human services in this community. And all those applicants at that time were, they're doing great work. They're doing work in the community already. And now that we have some other significant needs in this community, that we know that we have $5 million. And that's just something that as a community, I just know that we're going to have to figure out how to provide organizations with the resources that are to help deal with a lot of the social service ills in our community, to help uplift people. I'm excited about the work that this particular grant is really focused on economic stability, pretty much. And I just read an article recently that to get people to that place, it does require people having to have jobs that pay a certain amount of money. And no matter whatever we're doing, we've got to get people to that place. And in this community, we know it's about $17 an hour. And so we just really have to be honest about what's going on and how do we get people to make more, to get them to a place where they can make more money to take care of their families. And that will help with some of the other ills that are in the community. You're not working 84 hours a week to try to get to that place, because then you can't take care of your families, be there in the evenings, et cetera, et cetera. So I'm excited for the organizations that are going to apply. I wish them all well in this process. And I certainly, as we are moving through this process, I'll just leave it there. I know there have been some organizations that have had a very close partnership with us. And I want to make sure that we will still look at those organizations that have had a very close relationship with us. I'll leave it at that. I also, I don't know if you have any questions, President Pro Tem Stenziano or Councilman Remy. So Director Jones, I thank you. I see Elon in the back, who's been working on this, and I see Kim also. And I don't know if Michael Corey, if you want to make any comments at all, you are always welcome to, since you represent. If you don't have to, I'm just giving you the opportunity if you want to say something to the agencies and about this process and this budget. And as you're walking up, Councilman Stenziano wants to say something.
Oh, thank you, Madam Chair. And I was trying to fill time while Mr. Corey was walking up, but really wanted to thank you for your leadership. I know for particularly Councilmember Remy and I, we weren't here necessarily for the last round of these grants and working with the department, but I think we're well aware just how important this process is to a number of entities that Mr. Corey works with, but that we as council members and across the city. So I want to thank you for your ongoing leadership and guidance as we move through not only the budget process, but through the grants as well.
Michael.
Thank you for the opportunity to speak briefly. Just wanted to reiterate many of the things that have been said. The city's role in supporting the various efforts that are ongoing across the human services and social services sector is critical at a time when funding from other sources in federal and state government is more in jeopardy than it usually is. City support is really elemental, and the city has been a great partner in numerous ways, including throughout this process under Hannah and Kim's leadership, and certainly yours as well. So thank you for all of the work that you're doing in supporting our nonprofit agencies in Franklin County.
Thank you, Michael. I also make another comment. This $5 million are for social service agencies. We certainly are funding the Community Shelter Board. There's other organizations that are not included in this amount. And so I just want to make just acknowledge that to the viewing and listening audience, that there are other funders that are getting dollars that are not included in these, they're not a part of the competitive process. Thank you, Michael. And I also, Dr. Roberts, can I ask you a question? Could you just, I'm sorry to ask this question, but could you please just speak on the funding of Primary One? Are they still included in your budget?
Yes, thank you, Councilmember Tyson, Chair Tyson. Primary One, which is our largest federally qualified health center here in Central Ohio, has been funded by the City of Columbus for many, many years, actually started as a part of the City of Columbus, and their funding and our budget remains, and they will have stable funding for 2019. So yes, they're a vital partner of ours.
Thank you. So again, thank you, Deputy Director Jones. Thank you, Kim, for your ongoing work to support our nonprofits. And thank you for the work that you're doing about youth homelessness too in this community. So thank you. We will now entertain public comments. Our first speaker and our only speaker is Jacqueline Neal, and from the Ohio Minority Supplier Development Council. So please walk towards the podium, come up. Please state your name and who you represent, and you have 3 minutes. Good afternoon.
Good afternoon. Hi, welcome. Thank you so much for allowing me this time. Chair Tyson, Remy and Stinziano. My name is Jacqueline D. Neal. I'm the president of the Ohio Minority Supplier Development Council. The organization has been around for 45 years. We're part of a national network, and what we do is certify, develop, and advocate for minority businesses. I'm really proud and happy to say that there are 43 minority certified businesses in the city of Columbus. They represent $1.1 billion in sales. Think about the number of jobs that they create and the number of sales taxes and sales revenue that they generate for the city. Councilwoman Tyson has been a proud supporter of our organization and help us develop our minority businesses. And we are seeking more support. We have another program with the Ohio State University Fisher School of Business. It's focused on operational excellence. So it's not a mini MBA, but it's focused, and we designed it specifically in response to the needs that we heard from our corporate partners. MBEs need to get better at the operational excellence part of their business. So we had a pilot program last year. We had 20 MBEs in the pilot. Councilwoman Tyson supported 5. So we're really proud about that. And we're looking for another 5 to send to the program. It starts in February and it runs through June. But we're real excited about it and what it does. We got a lot of great feedback from the MBEs. Right now the feedback is qualitative. We're going to start tracking them and put metrics in place so that we can see the sales and increases and have some quantitative metrics to go along with that. But we're really excited about what we're doing on behalf of MBEs. As you know, they're the lifeblood of the economy, so the more we can do to support them, the better we all are as a community, because the data has shown that if you invest in minority businesses, they tend to hire other minorities, and that helps to change the dynamics of a community and transform generations forever. And I'm a proud recipient, and my dad was an MBE, and that's what got us out of the housing projects. So it really does have lifelong impacts. Thank you.
And thank you, Ms. Neal, and certainly it was a great program on partnering with your organization and the Ohio State University. I know we sponsored 5 individuals. I think we're 5 women that went through the program. We just mentioned this at one of the council meetings, that one of the businesses just got a city contract from, I think, diversity search firm, Teresa Sherrill's business was just, I think, awarded a contract from the city. So we know that by providing those additional resources and, you know, the training for individuals to grow their businesses, that they can get not only contacts with the city, but also other entities in this community. So I thank you for your leadership, and we will certainly take your request under consideration.
Great. Thank you.
Thank you so much.
Thanks for your time.
I think we have one other speaker. It is, because he's here now, John Tolbert. Sir. Good evening. Please state your name and who you represent. You have 3 minutes.
Good evening. My name is John Tolbert. I'm with Primary One Health. And I just briefly wanted to thank you for continuing funding Primary One Health, which enables us to continue our work around infant mortality, our dental program, and also the most important thing is to provide services, health services, excuse me, to the many uninsured individuals here in Columbus. So with that being said, and the work that we've done with Columbus Public Health and many other partners in the community, your funding and continued funding and blessings on what we do in this community is much, much appreciated. Thank you very much.
Thank you, John, for coming down, and just appreciate your work also working with individuals who are who leave the hospital and don't necessarily have a place to go,
Yes.
and that you're providing those services through the shelter board to provide that with our residents, as well as you mentioned, there are a number of people in our community who are still uninsured, and I appreciate the outreach to ensure that they could come there and get all the services. And as you mentioned, dental is one of those services that is very difficult for individuals in our communities to get if you don't have insurance, and that you have a great dental program through your organization, and I just really appreciate your outreach and the work that you're doing.
Well, we appreciate you because I know for a fact that many times when we have events, you always show your support, and it's much appreciated.
Well, it's really all about the community and making sure we have this great resource. Not many cities across the country have this resource.
Yes.
And so that the city funds, and so I appreciate that we have the ability to continue to support the fine work that your organization is doing in our community.
Thank you very much.
Thank
Good
you.
seeing you.
Thank you. As you've heard from the city has prioritized the needs of residents through working with restored citizens, public health efforts, and social services funding. Over the next several weeks, Council will continue to hold committee hearings on the Mayor's 2019 budget. We will expect to pass the budget in early February. Before we conclude this afternoon's hearing, I want to thank Amy DeLong, the Executive Director of the Civil Service Commission, and Tarika Cradle, Coordinator of Restoration Academy, for their hard work on this so very important program. I also want to thank the Health Commissioner, Dr. Mashika Roberts, Hannah Jones, Deputy Director of Community Development for the Development Department, of course, Kim Stans. Again, Michael, I thank you for your leadership in this community. I want to thank Matt Erickson, who was our Senior Legislative Analyst out of the Legislative Research Office. I want to thank Andrew Dwyer, who's also a Senior Legislative Research analysts for us, Nicole Harper and Carl Williams from my team, and the staff of CTV. And always, I want to thank my council colleagues, because we could not do this work without each of us working together in support of our community. So I thank you for the work that you do each and every day. And lastly, I thank the residents of our community who allow us this opportunity to be able to serve them in such an incredible way. And with that, I will say this hearing is adjourned. Have a good evening, everybody, and be safe and stay warm.